I'm Kjell Arne Johansson. I'm a professor at Bergen Centre for Ethics and Priority Setting in Health and also a physician at Haukeland University Hospital in Bergen. I will now give a mini lecture on process, fairness and legitimacy in priorities in health. How can we include the interest of people into decision making? That's the question, and that is the core of a fair process. And we have 4 reasons why we need a fair process in health. First, we need to include the views of those that will be affected by those decisions. We need to provide legitimacy and trust to the decisions we make. Third, we need to have value trade-offs informed by public values and views. Fourth, social learning, transparency is important. If we increase transparency about decisions, there is a higher chance that the public will participate and they will learn about the difficult trade-offs in priority setting in health. We expect disagreements on evidence, indicators, analytics and methods. We also expect disagreements on what principles and criteria to include, and we expect disagreements on the relative weight of the criteria that you include. Accountability for reasonableness is the most influential theory on process for priorities in health. It has been used in countries like Norway, UK and elsewhere. 4 minimum criteria for fair process has been defined by the philosopher Norman Daniels and the psychiatrist Jim Sabin in 2002. Initially it was developed as a theory for process for setting priorities in profit health insurance companies in the US, but it has been used also in the public sector. The first criterion is transparency about both the decision, what you say yes and no to, and the rationale behind it. Second, these reasons need to build on relevant reasons, and you can learn about what relevant reasons are in the video about principles and criteria for priority setting in health. Third, revision and appeals is important because things will change over time. People may disagree and there need to be mechanism to appeal and to revise as time goes. Fourth, institutionalization of this is also important. You need strong institutions with people who know how to do health technology assessments, do health economic evaluations and equity impact analysis. The World Bank recently launched the report Open and Inclusive, Fair Process for Financing Universal Health Coverage, and building on accountability for reasonableness. 3 principles were defined as core: equality, impartiality and consistency over time. Also, accountability for reasonableness were defined with these add-ons: the voice, what does it mean to be inclusive and participation; oversight, what does visibility and enforcement mean; and information, how can you improve transparency. But even this World Bank report is very general, and here is an example of a very applied process that has been tested in Zanzibar, building on the experiences from Ethiopia on priority setting in health. And there are 10 steps, and this was defined from 2019 to 2023 during the revision of the National Essential Care Package in Zanzibar. And we see that there are 10 steps and 5 different phases. And across all the steps and phases there are 3 important principles: involvement of all relevant key stakeholders, transparency about decision and rationale, and deliberation. And what do we mean by deliberation? That means thoughtful examination of different perspectives, arguments and information to arrive at well-informed decisions. And this applies in all the steps throughout the process of setting priorities and defining an essential healthcare package. It's a very pragmatic 10-step. First, you need to plan, you need to develop a roadmap, establish management. You need to identify criteria for selecting interventions and identify interventions that you want to consider. You need to look at financing, and then you need to do the analysis, and you need to actually sit down and set the priorities, what is low, minimum and high priority. And Final phase, implementation and monitoring phase. You need to think about the implementation, how the package and priorities will be implemented, and how will you monitor and evaluate the package. And so it goes on. This is an ongoing process.